You may remember that when we talked about primary bacterial inflammation of the bowel, we always started out the list with Salmonella and Shigella, Salmonella and Shigella, and then there's always a few you could remember after that. Well, we saw Shigella because that was the basis of the bacillary dysentery. There is, however, another typical syndrome called enteric fever caused by Salmonella. And Salmonella and Shigella give a variety of clinical symptoms due to a very, very, very severe inflammation of the bowel. And in this case now, with Salmonella typhi, or the causative agent of typhoid fever, we can see in the small bowel, and you know that it's small bowel because you have a very, very nice, thick longitudinal muscle layer, as well as the circular one, as well as a tremendously, whoppingly inflamed submucosa and mucosa to the point where you could barely recognize, in fact, you can't recognize villi at all. And then just a massive ulcer here in the mucosa, in which all of the large vessels of the submucosa are open to the exposed lumen, some of which are dilated and also surrounding a nest of necrosis in this ulcer bed as well. This is a typical small bowel inflammation of typhoid fever. In the historic past, causing epidemics, killing as much as a third of the population of Athens. And of course, it's the thing that did in our friend Alexander the Great as well. Let's just take a close look. And once again, we're not going to find the distinctive organisms here, but we will find the classical changes. Perhaps here you could see some remnants of villi again, but you could see there is a whopping chronic and acute inflammatory infiltrate throughout the mucosa and submucosa to the point where there just is no mucosa in areas like this. And let's zip in on it a little bit more if we can, hopefully. Well, let's try in a second. Maybe we'll be able to look at some more of the mucosa here. Here's some remnants of mucosal glands. Here is a tremendous, what looks like lymphocytic infiltrate, and even at this power, you can suspect they might be lymphocytes because you could see a secondary follicle here with a germinal center. And you could see that this mucosa has just been sloughed off, and of course this is the very, very serious, opens up the gut to all kinds of infections. And of course the disease itself is a very serious infection, often fatal. This is the very worst thing Salmonella can do. Let's see if we could zip in a little bit, and hopefully our computers are working a little bit better now. Yep. Here are the chronic inflammatory cell infiltrates. Here is a significant amount of inflammation throughout the mucosa to the point where the villi are no longer recognized. Here is the ulcer bed, in which you could see fibrin and acute inflammatory cells. And let's hopefully zip in on that a little bit more now. You can see the vast majority of these cells here are neutrophils, fibrin, necrotic debris, whereas in the deeper mucosa and submucosa, we have primarily a reaction of lymphocytes. This is caused, it is not in itself pathognomonic of Salmonella typhi or typhoid fever. If we could see organisms like this, however, deeply within our microscope, which of course we can't, the Salmonella organisms, especially typhi, have flagella, which are much, much longer than the body of the rod-shaped bacteria itself. Here's another picture. If we could really, really go high, this is a beautiful picture showing how the flagella attach to the capsule of the organism. Salmonella typhi enteritis, cause of typhoid fever. Thank you very much.